Hello, everyone. Welcome back to our study of mind rubrics from Kent's repertory. And today we are going to learn about the rubric blindness pretended. Hmm? So you can see this boy, he's pretending to be blind so that he can sit on girls' laps and have some undue advantages, right? So, blindness means a state of condition of being unable to see. I can't see things because of injury, disease, or any congenital condition. What does pretend mean? Pretend means to behave as if something is true when you know that it is not, especially in order to deceive people or as a game. Hmm? So it means people who like to show that I am blind, that I can't see, I can't hear, and I can't do certain things because I am blind, and mm, because of this, I will get the sympathy or the affection or the attention from the opposite person. This need to get some kind of help or affection, attention or sympathy from opposite person or some advantage, to be at an advantageous position, you pretend, you show something which is not. And you here specifically you're showing that you're blind when you are not. Now there is only one remedy given by Kent for this, that is Viratram album. So I'll just tell you one or two cases. So I remember one of my teachers, Dr. Sunil Anand, he shared one of his cases once, and it was a case of a boy who used to work in the canteen of a college where sir used to practice, and there he saw that this boy was dumb and deaf. He was asking as acting. He was dumb and deaf. He couldn't talk. He couldn't hear properly. So because he couldn't talk properly, mainly, uh, or not at all, he was brought by one of the college students to him, and they said, "Ki, sir, let's try homeopathy. Maybe it will help him." So, looking at the situation now, the boy is also not able to talk much. He can't hear what questions we are going to ask, and he is not educated also. So you can't write and read also. So it's very difficult. What case will you take here? So he found it very difficult. So sir thought, okay, let me give myself some time, and he gave him SL. He gave him placebo, and he called the boy back after 15 days. 15 days back after, this boy comes and he starts to talk a little bit, and he starts to say that I am able to hear better than before. And then he is like, what is happening? He gives SL, and again the boy starts comes back and says, again I am improving, right? So then at that time when sir studied the case, that time he realized that there is a rubric in our materia medica which says that the patient pretends to be blind. In fact, there are more rubrics, that patient feigns to be dumb and deaf. In that also you have Viratram album. So that is how Viratram album are. They feign that they are ill, or they are having some kind of disease or some kind of abnormality, because they feel because of that he will get some sympathy, he will get some affections, he will have some social status. This is very important for Viratram, that they have some social status, right? Social status meaning, I have shared this case previously of a man who owned a ice cream factory, and he felt the other members in his family, other cousins, are doing very well with their own industry, with their own factory, and now he feels that he has to also match their level or their amount of money. So to match that, even if he did not have the money, he would uh, purchase a very luxurious car, or he will purchase a very expensive watch or something, just to show that I am also belonging to your status or your company. I am also of that league, or I am also that rich like you. This need to belong to a particular social status is very important in this remedy, and in fact it is important in this family. So if you another remedy in this family is sabadila. It has this feeling that I am pregnant. If you see this, that rubric, that feigning she is pregnant, again you find Viratram album there. But if you read Keynote, Alan's Keynote, and if you read Sabadilla in it, again you will find in Sabadilla the patient has this delusion that he or she is she is pregnant, etc. So this feigning, this showing, this faking of things which are not true, which are untrue, is common to this Lily Floresi family. And the main thing of Lily Floresi family is this desire to maintain this certain kind of status or certain kind of social position. And to maintain that, if they see that they don't have the resources, they don't have that kind of actual position, they just feign, they just show that I also belong here, I also am rich, or I also have got. See, people think that, if I'm a newly married girl, if I don't get pregnant, people will think, oh, especially if you're in India, people will think, oh, she's not getting pregnant, maybe she's not healthy, maybe she has some problem. So people try to exclude her, they don't try to call her to certain kind of social functions also. No, after a certain age, people will not ignore you, they will not call you for very good important mm, mm, religious functions, especially because they feel that she's not a fertile woman, so we should have a fertile woman doing such kind of work. So they exclude, they don't include such people, they don't call you for such functions. This is the main sensitivity of this family, that I am not being called for social functions, to socializing places. Hmm? Whether it is Lilium Take, Sabadilla, Viratram, all of them have this need for social belonging, especially when it is a group. It's not one or two people not accepting, that is also important for them. But what is very very important for this family is need to belong to a social community, that I belong to this community, I belong to this status, I do belong to this com- company, etc. Right. One more case that comes to mind is of a 40-year-old man who came to me because he had some skin problems. And his main thing was that in my childhood I belonged to a very poor family, but my father, with all his effort, he put me into a very very good school where very very rich people used to come, and I had got their admission out of scholarship, so I didn't have to pay the fees. So my father was managing. He had to pay a certain amount of fees, but that itself was too much for him after the scholarship. But he was somehow managing. And when I started going to this school, I observed that everybody was talking that last holiday I went to Switzerland, this holiday I went to Hong Kong, this holiday I went to Paris, yesterday I went to this mall, day before yesterday I went to this movie. And he's like, I've never seen what is a movie theater like, what is a mall, what is shopping, what is traveling. Oh my god, I don't know anything. So I used to just fake. Yeah, I also went to Switzerland. It's a good thing. So I used to fake. And after some time, I started to realize that these people, they are not accepting me. They have slowly started to recognize that, you know, maybe I don't know something because I was getting caught. So then I started to realize that I have to find something else. And I was not understanding English. So I was not understanding what the teacher was teaching me. So I came to know that I am also going to fail in my exam. So now what to do? My whole position will be gone now. If friends will not accept, teacher will not accept, I will fail, my father will not accept, what do I do? So that's the time I started feigning. I started saying that, oh my god, I have stomach pain when I didn't have. And I started saying this so much that I actually had started having stomach pain later on. Hmm? This feigning is what is very very important in in this family and in this remedy. Hmm? Feigning, pretending, showing something that is not there. Hmm? Cross references. We already learned feigning sick, feigning pregnant, affectation. Now this is similar to feigning, pretending, faking, etc. Affectation. What is affectation? We have already recorded a video on this rubric. Affectation means, again, you show something that is not, but the primary intention is in affectation is only to impress, only to mm, 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 show the opposite person that I am good. It's not to belong, it's to just show that I am good. I also know it. The main, there's only one remedy in this rubric affectation, that is stramonium. And I suggest um, you can watch that rubric. But one case that comes to mind is, it was a woman who got this remedy, and she said, I have a lot of stress nowadays. I said, what's the stress? Doctor, I go to various companies and do personality development lectures, etc. And then I see that there are other competitors, and then people just talk anything. They will say that, for example, they'll say that I always wear branded clothes only, or I always use branded things only. And then I look closely that now itself the clothes that the person is wearing are not branded. How can they just fake like that? So I see they are just telling lies, and they are telling things that don't um, mm, or that don't stand the truth. They are false. Mm. So this was one of the symptoms. Other, obviously, she had other symptoms of panic, fear, dreams, etc. So she got stramonium based on that. But when I saw this narration during the follow-up, I didn't know. I felt maybe I have to change the rubric. So I looked at various rubrics of stramonium. Then I remembered, Are ha, stramonium is there in this rubric affectation. Hmm? So that's it, friends. That's what I have for all of us today. I hope you learned something from this video. Look forward to your feedbacks and your suggestions.